Lieutenant General Anup Banerji, thank you so much for giving us time. So I recognize how busy you must be in these times. But just an overall picture, sir, if you could give to us of how much the armed forces have contributed in the fight against the COVID pandemic, and in specifically the armed forces medical service as well.
Thank you, Mr. Amitabh, for giving us the opportunity to interact with you. And it's a call from the nation, so nobody is so busy. On the contrary, it's an opportunity to contribute to the armed forces and the nation at large. So to recapitulate, the armed forces has been proactive and prepared right from January when we got the first news of the occurrence of this disease at Wuhan. And from mid-January, we have been issuing what is called advisories. These are advisories which educate the clientele of our own, the three services, as to what the virus is about, what are its threats, how does it travel, what are the preventive measures. And such advisories we have continued. There are about a dozen advisories which we have brought out, which also talks about the transmission, the preventive measures, the social distancing, contact tracing, hygiene in the office. We have dealt with each and everything. Also, which is very important, is maintenance of the quarantine camps and the isolation facilities. So on 27th, we had a meeting chaired by the Honorable Cabinet Secretary, in which we also had representatives of the Chief of Army Staff, who were very senior officers of the headquarters Delhi area for the administrative part, and I was there from the as representation of the tri-services, and we sat together. We were tasked to establish a quarantine camp, which we now call as medical quarantine camp, for the evacuees from Wuhan. And
you're calling them wellness centers now, sir, General?
We will stick to medical. Being a medical.
Okay. Go ahead, sir.
Yes. And in a matter of 48 hours, we could convert the quarantine. We could convert the camp, which was erstwhile being used for serving soldiers in transit, to a medical quarantine camp, which has its own characteristics, has its own differentiations. And on first, we were there to receive the first batch of 248 evacuees. That was the beginning of our exercise. And to talk about the Wuhan camp, there have been evacuees thereafter also. And we are very happy to say that it was a very successfully conducted camp, in that because of the strict adherence to the SOPs, advisories, we could have a perfect match of quarantine, discipline, diet, nutrition, segregation, hygiene, and personal comforts and recreation for all of them. So we had just 2 positive cases from arising from this camp, which were treated adequately, and there were no infection that spread between other camps. And all of them were dispatched because that was the pre-lockdown era. After which we've had total number of 1463 evacuees in the various quarantine camps that we established. And as on today, we have 1073 evacuees which are still with us. And these are camps at Manesar, the first camp, thereafter at Hindon, thereafter at Ghatkopar, then Jaisalmer, then Chennai, and now at Jodhpur. So this is how we established the camps, and this was the beginning, the way we started. This was to treat our so-called Indian nationals from abroad who came to us. Then the other contribution that we have done till now is our role played in the Deaf Expo at Lucknow, in which we were asked to marry up with the UP state health authorities, in which we contributed by setting up screening clinics, screening camps at the airport, at the site of Deaf Expo, and we had a backup of our base hospital should there be any cases needing isolation or management of complications.
General, you were mentioning Wuhan, and now this is a tri-service operation, even though the Army is taking the lead because of its resources there. You were mentioning the Air Force Hindon Station as well. We spoke to Group Captain Patnaik, who was the team leader, squadron leader of the 81st Squadron that flew out the nationals and international citizens who you were mentioning there. So it's a tri-service approach, though the Army is taking the lead because of its resources, sir?
It is tri-services. We are at total sync. Whichever meetings we attend, They are chaired by the CDS. We have tremendous involvement and contribution to the 3 service chiefs, the general officer commanding at the various command level, the so-called FOCNCs of the 3 naval commands, and the AOCCs of the various Air Force commands. We have the 3 DGAFMS, and we are working at total sync because of the various location of the camps, be it in the tri-services because of the air evac by the Indian Air Force. And at the office of DGAFMS, we are tri-services. So we are at total sync, we are at total symbiosis when we perform. And we are so happy that we are made this way.
General, we were talking largely about quarantine facilities and Indian nationals and other nationals, international citizens who had been brought back to India. What about the armed forces itself? How are you taking measures, and what are the measures that you're taking to prevent the spread within the armed forces itself?
So before that, I will sum up 2 more
sure.
salient contributions by the armed forces. We, because of our honorable Prime Minister's commitment to the SAARC countries, we have lived up to his expectations also. We have sent a team to Maldives who have acted as force multipliers. We are so happy with the select team in which they have augmented their diagnostic facilities. They have talked about preventive measures. They have increased the number of tests that were being done to them. And I must admit that because of their contribution, there's been no positive case after the team came back. We are prepared to send other teams to SAARC countries as and when we are asked to be with our Honorable Prime Minister's dream vision. And besides the quarantine camps, we have isolation camps for patients who should deteriorate to be taken there. And now we have enhanced the capabilities of 89 of our hospitals. 89 of our hospitals, we have beefed them up as far as equipment, manpower, that's all that we need. So we are prepared to take more cases should they become positive and should they require hospitalization. And we are also part of Train the Trainers.
Yeah.
We have undergone a central capsule organized by the WHO and ICMR at Delhi, after which these group of people have gone into so-called formations and they are training other people. And we have also established helplines. We have established helplines by 2 groups of people already. First is our community medicine people. Second is our anesthesiologist or critical care medicines people. This helpline is to so-called assist, educate any doctor from anywhere in the country who needs an advice how to manage patients on the ventilator, because ventilation is a very important, tricky and rewarding procedure. Plus how to ensure preventive measures in their community to run camps if they need it. So we are there to be part of the national program to get over this pandemic.
General, again, one crucial aspect that has come out is general populace, yes, bringing in Indian nationals, other international citizens. You were talking about helping outreach to SAARC. Maldives is extremely grateful for the team that you sent there, and you saying quick reaction teams are ready to go to other countries as well. But protecting the protectors, now that is really crucial. So what is being done in the armed forces itself from top to bottom to prevent the spread?
First and foremost, as we know that we are a very disciplined group of people. So whatever is passed as advisories, the health awareness has come up to by leaps and bounds in the last decade. So since we are such a disciplined group of people, the 3 services, we are sure that whatever measures we have taken, they are going to be followed individually, within families, within camps, within cantonments, within offices. And I'm sure, therefore, it will be a very strict way to ensuring that the graph doesn't go up. So what has been done, as I told you, we have issued advisories which are percolated down to various commands and it has been talked about everywhere. Then we have the IEC, Information, Education and Counseling. This is a very effective method of educating people about the do's and don'ts. We have brought out education posters, education in various hubs like canteens, schools. We have brought out short films which are being shown at various places before this lockdown came in.
Sure.
And other measures that have been taken by our administrative headquarters, they have stopped courses or training programs which were occurring. This was spelled out. 23rd March was already a was given before the lockdown came in. So we are ensuring that no fresh courses, that is a measure of social distancing. Then we have ensured that the non-essential events like welfare activities, meetings, conferences, there's a big no to that. And we have ensured the schools are closed. We are ensuring that the families stay within the house, they don't come out at all. And we are also ensuring that even amongst the emergency service, that's why you're finding me in office today as a healthcare provider, we are ensuring not only social distancing, but the barest minimum number of people to attend the offices. And as they say, it's a dynamic process. We are following all norms to ensure that our community of the armed forces does not fall a victim. And as you are aware, there is just one individual at Ladakh who being a dutiful son to his father, to his infected father, and he is safe and sound. So.
He was on leave and his father had just come back from Iran, and subsequently the family have been, and all the people who they've been in contact with have also been put under quarantine, etc.
Due to his close contacts have been quarantined and they have all tested negative.
In terms of this large number of possible working from home situations that you're referring to, how does the operational readiness be affected in that case for the armed forces?
Amitabh, I'm a medical man.
I know. I still had to ask that.
Myself, my own.
Sure. Again, but just going to say the facilities that you've set up and are planning to, if the need comes in various cantonments, etc. I would presume those are kept away from your battle formations or your troop camps.
Yes.
Would that be correct?
Yes, we are avoiding so-called infection, but as is well known, it's just 1 meter of distancing. So we are taking all stringent measures.
No, what I meant was the quarantine camps are separate from where your troop bases are by a large distance, I presume.
And let me also bring out in my interaction with you the few contributions we've had from the ICMR and the WHO. They've helped us to establish 5 viral research and diagnostic labs. And we have gone ahead. We are readying another 6 in various places. These 11 hubs will be the areas of testing, and then various collection points where we can again. And I can assure you there have been issues about personal protective equipments, about gowns, about hand washes, about diagnostic kits and tests. But the nation has responded with full vigor and enthusiasm and commitment. So in the various meetings that we've been having, so we are on board.
So you're saying whether it's PPEs, ventilators, sanitizers, gowns, masks, there's enough for not just the armed forces, but for any other requirement that comes up.
Yes, about the PPEs and all, we are presently looking at the armed forces because others people have their own sources, but we are prepared to take on any challenge given to us. We will rise to the occasion.
When you were talking about those viral the laboratories that have been set up with the ICMR and the WHO, is there any research that is happening, say, within the Army or the DRDO, whether it's about testing kits or cheap equipment or even going further towards a vaccine?
Yes, let me assure you one thing at a time, especially with this My Labs coming at Pune, coming out with ICMR certified testing kit, which is very economical and which takes very little time. The best part of it is going to give the result far before the other tests which were testing other viruses also. So that will be our modality of procurement. And let me also assure you that the Armed Forces Medical College are so-called feather in the cap. They have already embarked on research projects from the Department of Clinical Medicine, from the Department of Community Medicine, from the Department of Preventive Medicine, and from the Department of Pathology. So I'm also so happy to announce in your forum that the AFMC has also started research projects which will help us later on in the future, and has been talked about by various specialists that the vaccine is going to take some time. So the research is on, and as has well been talked that they are the world is looking up to India to come out with the vaccine and conquer the way polio and other things have been. So everybody is risen to the occasion.
General Banerji, again, you were talking about the armed forces in various setups within the country and what is being done to prevent any spread. You have forces, say, in the UN, whether it's in UNMISS in South Sudan, etc. And I believe that the rotational deployment has been stopped for now. They will be staying there. So for troops or any kind of forces who are not within geographical boundaries, like, say, at the UN, or naval ships that are on patrol, because now we hear US naval carriers are reporting up to 25 cases. What's being done to prevent the spread there?
Yes, I will just give you two examples today. Firstly, as you said, the UN missions that were required, that had completed their mission or tenure there, are staying back. And our troops who are from Nepal, we have a sizable amount of troops, their leave has been extended officially. So all measures are being taken. And once again, our National Institute of Virology, Pune, is also helping us great. They are at it to bring out a vaccine. So we are taking preventive measures at all ends, and as you said, all these meetings are being chaired by our CDS, by our service chiefs. So we are absolutely in sync and together.
And the ships that are deployed in international waters, how are you handling that situation?
That I would like the.
I see.
Fair I assure you, all measures are being.
Fair enough. Earlier,
so tell you.
General, yeah, go ahead, sir.
Some by saying that even in, I can assume, and therefore tell you that all these advisories which we had brought out about sanitizing the decks of the ship, the cabin by hypochlorite, viscally black, they are being mentioned. So that way, and we have not had any positive case of it. So mechanism in use.
If you could elaborate, General, a little bit more of what you talked about earlier, or the armed forces preparations, if needed, to set up hospitals or other facilities in the future for civilian population. So what are the measures being taken there to prepare for that?
Yes, we are preparing COVID hospitals and COVID wards. First and foremost, we have beefed up all our tri-service hospitals where we had a critical care specialist and a physician. These are the two basic doctors who would be required to manage such cases. About 89 of such hospitals are being beefed up by equipments which the Honorable Raksha Mantri has given us special financial powers which have been invoked. And about COVID wards and COVID hospitals, they are being created in stations, ideally where there were two hospitals like Lucknow, Panaji, where you could convert one of the hospitals into a 100% COVID hospitals, which would house only COVID positive patients. And COVID wards are being created in all other hospitals, depending on the size and depending on the requirement that is to come. And we are also getting prepared for the emergency, as is being brought out by present statistics, that out of 100 patients who are diagnosed, about 80% of them will have very mild disease who can be managed at home quarantine. And only about 5% of the entire 100 will require real ventilatory support and critical measures. There will be another 10% who will require hospitalization. So that is the figures we are having till now. So we are gearing up for that. And nothing can be predicted as on today. Let me tell you, Amitabh.
Right. Absolutely. So would the armed forces be looking at, say, since this is just a question off the top of my head, in terms of how railway services have been stopped, I mean, apart from air and the lockdown, would you say, if we don't have areas, be looking at setting up facilities within railway coaches, if need be?
You brought out a very relevant point, and let me also assure you that we have had consultations with the authorities. Our advice has been taken. We have also shared our advisories. So I'm sure that will be a final call by the Indian Railways. I have nothing to say in that. But
sure.
As medical advisors, we have had meetings with them, and we have communicated our viewpoint, and which has been accepted in a very welcome way. We are so happy that we are again force multipliers in any way which we can for the country.
So you're part of the front line. Some even say the last line before the spread of the pandemic into the population itself. Of course, there are the health workers, the people screening at the airports, the Air Force bringing in citizens of both India and international citizens itself. But what is the message you would like to give, sir, as the Armed Forces Medical Service Head Representative to the country?
The two keywords are social distancing. That is the most economical way of cutting down the transmission chain. And the other keyword is No to panic, yes to prevention. And
Gen-
as we say, our motto is "Har kaam desh ke naam." So these are so.
General Anup Banerji, I really appreciate your time at this very difficult time and very busy time for you as well. And so hats off to you and a salute from the nation to the armed forces.
So let me first acknowledge the contribution of each one of the tri-services who is giving their very best, who is standing up to the challenges, and who has again risen to the occasion to keep our motto of Sarve Santu Niramya. By I mean right from the general officers to the vice sailor or airman. I acknowledge my contribution to each one of them. And as a collateral, I also thank those people who on the day of the Janta curfew, honored the contribution of doctors in general, and at 5 p.m. gave such a rousing acknowledgement of the contribution. So we have, and we shall always do.
Thank you again, General Banerji, so much for your time, sir.
Thank you, Amitabh.